Brilliant. So that's us live. Hi, this is Dr. Claire Gilvray. I'm from Cognitive Sports Therapy, and this is our time to talk for Eating Disorder Awareness Week. And I am very excited to have Dr. Caz Nahman with me here today. Caz is joining us from Tenerife from her holiday, so I am really, really stoked that she's here to speak to us. I know Caz from the Royal College of Psychiatrists Special Interest Group in Sports and Exercise Psychiatry. You're the joint chair at the minute. Am I right about that? Deputy chair. And Caz, you specialise in eating disorders, but specifically, I guess, from what we're talking about today, eating disorders and athletes in sport. I don't know if you wanted to say a little bit more about who you are and what you do to sort of set the scene a little bit.
Hi, so I'm a child and adolescent psychiatrist, and I work in a community eating disorders team currently in Oxford. I run a small private practice where I do see athletes with Red S and with disordered eating and the milder end of eating disorders. And I have an interest both from the eating disorders in athletes, and we know that athletes are at significantly greater risk of eating disorders compared to non-athletes. But I'm also interested in exercise, which is both a problematic symptom in eating disorders, but actually it can also be a huge motivation to get well.
Yeah. And I think this is the reason I kind of got in touch with you, because I know that you were part of a kind of conversation that happened quite recently to look at what the advice, the evidence is around exercise for eating disorders, because I think with cognitive sports therapy, because we look at people's physical health and their mental health, eating disorders comes up a lot. And my guts, and I guess a lot of my learning, is that exercise is really good for our mental health, but we're always really cautious, aren't we, about using exercise when it comes to eating disorders, because we know it's also can form part of that picture for people when they head towards over exercising in order to manage weight. So I don't know, what is the leaning or what is the thought at the minute to do with using exercise within the world of eating disorders?
So there has been quite a lot of prejudice against exercise, and for many years there was an exercise abstinence being preached. And the reason is that 40 to 80% of people suffering from anorexia nervosa struggle with unhealthy exercise, and about 20 to 60% of bulimia, depending which study you look at, there's also unhealthy exercise.
Yeah.
Now, the exercise is both for reasons of weight control and altering shape, but it's also a very good way of managing anxiety and trauma symptoms. So it becomes a way people might regulate their emotions.
Yeah.
So people have been quite scared of it and have forbidden it. But the actual research out there shows that complete exercise abstinence actually leads to worse outcomes, both physical and mental health. So that complete abstinence, what it means is that people never learn to manage exercise and never learn to exercise in a healthy way. So what happens is people get discharged from treatment with no skills in managing this, and it's very easy for it to get compulsive.
Yeah.
But we also know that there's incomplete protein recovery, i.e. incomplete muscular recovery without exercise during recovery. So it's always about when should it be introduced.
Okay.
Now, we are quite lucky because there's a group of Australian and Canadian, I think they're psychologists and physios, and it's called Safe Exercise at Every Stage. And they've done a really good literature review of when you can reintroduce exercise, and they've done by expert consensus how to introduce exercise. And they have both general guidelines, but also guidelines for competitive athletes.
Brilliant. And that's something everyone can access. Can we, if we Google that, could we find them?
Okay. Safe Exercise at Every Stage.
Okay.
That's available.
Great.
And then the other person I really love in this field is someone called Amy Gardner, who's written a book called I Move. And she talks about how to connect brain and body, how to develop a bodily awareness, incorporating mindful breathing. And I know you do a lot of that with your work, Claire. So I think you'd naturally fit with that really well.
Yeah.
But she uses gentle exercise to both manage trauma symptoms alongside developing better sort of almost parasympathetic nervous system and breath work to manage trauma in a different way, but also to reconnect mind and body. And it's a brilliant way of introducing exercise, but also doing therapy alongside it.
Because I guess that fits with what feels right, doesn't it? In that there's some movement that can be quite destructive, and there is movement that can be quite restorative, and involving the breath and involving sort of mindfulness. Sounds like it's kind of key in getting that right.
It absolutely is, as well as developing skills to manage trauma, skills to manage sensory regulation, and developing bodily awareness. So, people sort of thinking how their muscles feel, trying to develop an awareness of when does that feel good and that my muscles have worked hard and they feel really nice afterwards, versus when am I beating myself up and causing pain.
Yeah. It's almost like a relearning thing, I think, isn't it? About whenever people have been away from that kind of mindset for a while, it's almost starting afresh, isn't it? And kind of learning how to move safely and in a constructive way. Is it for everyone? My gut also says that the one conversation doesn't hold for everyone, and that there are definitely people I've met who actually a period of abstinence can be helpful. I don't know what your take on that is. Or
I think abstinence can be helpful, and what we know is there is actually a mouse model for compulsive overexercise. And these mice get very low leptin levels. There are all sorts of brain changes which very much mimic what we think happens in people struggling with overexercise. So a period of abstinence to allow some physical recovery, to allow some nutritional restoration, to let the body heal is really good. But then to bring in helpful exercise alongside therapy is really important.
Yeah.
And we won't always get that timing of it right. If there is never that brief period or that bringing down the levels of exercise, those brain leptin levels stay low. Okay. So that tendency to be on the ceiling and almost like a tired horse that's being whipped very thoroughly towards the end of a horse race, that kind of continues.
Yeah.
And that can be counterproductive.
And that's more than sort of BMI related, that's a kind of as a time lag. Is there a way of measuring that for an individual? Or
I don't think there is. I think the other bit as well is that when patients get underweight, it takes about double the amount of energy that it would take a healthy weight person to put on a kilogram.
Yeah.
And then if you add in daily exercise in a significant volume, that doubles again. Okay. So it's also thinking about, where is this person in their therapy? Can they eat enough to fuel this? Okay. Are they progressed enough in their therapy to actually fuel that additional exercise? But some of the things we look at is cardiovascular stability. We look at normal renal function. We look at the start of that nutritional restoration process. So if you've got someone who doesn't touch carbohydrates and is on a very restricted diet, you want to make sure they can introduce that into their diet, learn to tolerate that, and then bring in mindful exercise and gradually increase that according to what is helpful for that person.
Yeah. And I guess, again, that kind of fits with that kind of gut feeling as well, because more and more, particularly myself, maybe more than yourself, well, I don't know, the group of people I look after possibly are sort of heading towards normal weight or even overweight with their eating disorders. And I guess the thing I tend to say to people would be being cautious about looking at the BMI, because someone can still be in that energy deficiency zone even if their weight or the BMI is high. And so being cautious, that being cautious is not so much to do with weight, is it? It's to do with, as you say, how much energy they're taking in generally.
And the mindset. And we know exercise is a risk if it's used to beat ourselves up. if it's a chore, if it's I must do this, otherwise I'll feel awful. And it's really got to be about celebrating what our bodies can do. It's in the context of self-compassion and kindness to ourselves.
Yeah.
And I think that is absolutely critical and key.
Yeah. And this has kind of moved into inpatient units as well, hasn't it? So there's physios often involved now in inpatient units, getting people moving within the hospital environment. It's not just a community mindset. Am I right?
Absolutely. And there is a physiotherapy network who specialise in eating disorders. Yeah. There are too few and far between, and that's partly to do with our funding structures and perhaps not being able to fund the ideal care that we would really love for our patients.
Yeah.
But they're absolutely key as part of this. Our sports and exercise medicine colleagues. It's also about helping people with overuse injuries, healing those injuries and bringing in the right sort of exercise that's not going to cause those to happen again.
Yeah. And there's ways of screening for exercise addiction in itself, isn't there? There's kind of screening questionnaires that if there's sports coaches that are watching this, there is a way of just double checking that. I'm wondering a little bit like the older research to do with anorexia in particular, whether if you're in the world of your eating disorder and compulsive exercising, does that in itself almost drive an exercise addiction, if that makes sense? So we know that if you are energy depleted, that you almost, it takes over by itself. I got the feeling that exercise addiction is a bit like that as well.
So there's quite a lovely recent paper published, I think it was 2020 or 2021, Christine Sharma, and there's this big sort of debate between compulsive exercise, which is exercise to avoid negative emotions and negative feared consequences, versus exercise addiction.
Yeah.
And they think that exercise addiction occurs more in people who are really sort of avid gym goers, potentially athletes, where it follows more of an addiction pattern. Now, that can tip over into an eating disorder if there is energy deficiency.
Yeah.
And those with eating disorders where it's a secondary exercise difficulty, that fits more with a compulsive exercise pattern, where there's exercise to stick to very rigid rules, to ward off negative emotion, to avoid a fear state, to avoid negative emotional consequences, to avoid breaking rules. So kind of both models fit, but it's why it's also important that we do really good formulation.
Yeah.
And why for each individual we look at what came first, what happened in what sequence, how did this develop over time, what role does it serve in the person's life. There are specific questions for athletes. There's the athlete relationship with training scale. There's the compulsive exercise test in athletes, but there's a whole host of questionnaires for non-athletes as well. Yeah. So there are plenty of ways of measuring it and plenty of ways of looking at it.
Because I don't know, again, just I'm aware of time, maybe not take too much more of your time, but one of the things that I was really interested in was for my master's, I did some looking at that link between, I guess, addictive personalities generally and actually trying to use addiction in a positive way to almost treat people who have addictive personalities who would normally be addicted to other things. I don't know whether you've any take on that, like within the world of alcohol dependency or drug dependency. Can we use this learning in any way, do you think, to help?
I mean, certainly exercise can be a behavioral addiction.
Yeah.
And sometimes those things that drive the problem can also be individual strengths, which have just tipped too far.
Yeah.
So it's trying to help people find a middle ground, and it's not writing off those qualities as being bad qualities, but maybe things that have gone too far. So there's a very fine link between being driven to becoming obsessional.
Okay.
And it's how we help people find that middle ground.
Brilliant. Is there anything else you specifically wanted to say on this topic that I'm kind of we're not touching on? Again, just being aware of time. Is there any particular message?
I think it's really important that coaches are able to talk to their athletes about this.
Yeah.
and that they are able to, they don't worry about saying the wrong thing.
Okay.
They might well cause upset. Sometimes the initial response when you confront someone with this difficulty is absolute denial and distress.
Yeah.
But if we can do this in a non-shaming way, we open up a lot of conversations and we help people.
Yeah.
And they're more likely to successfully stay in their competitive sport if it's spotted early.
Yeah. It's that kind of reducing the stigma a little bit, isn't it? I think more than nearly any mental illness, there is this secrecy that is around eating disorders. It's very much behind closed doors. And as you say, often people can get quite angry whenever it's approached, but learning how to say it in the right way and making it more of a normal conversation probably does help with that. As you say, people then feel less targeted or less visible, I guess, if it's done in the right way.
Completely.
Brilliant. Thank you so much, Caz, for joining us, particularly from your holiday. And I have said to Caz just before we came on that often I get questions after a talk like this. So if there's anybody who's got any questions that they'd like me to pass on to Caz, please feel free to contact myself. And go and enjoy your holiday, Caz. Thank you very much.
Take care, and lovely to see you.
Yeah, you too. Take care. Bye-bye.
Cheers. Bye.
Bye.